the current situation as it is. And from the discussion that has been going on in the national forums, I think up to yesterday, the reports that came out is that we have reported the lowest. We are at the lowest prevalence, we are at the lowest infections, and we are at the lowest admissions. And I think that is what we just want to look at, the far we have come from where we are, and also just recap on some basic information that could also be important for us to know as we move forward. So basically, it will be a short presentation, and thereafter we'll have some discussion that could also be important for us as an institution and also at an individual level. And we'll go through just a recap or a refresh on classification of diseases, because it's also important for us to understand why we have had a number of interventions and what informed those interventions, and how do we move forward in that line. Then we look at some of the epidemiological characteristics of COVID-19. Then we look at the infection, then just some basic definition on the prevention and control. And I think what will come after would be just a discussion on what we can really look at as we move forward. Basically, we decided to have this basic definition of communicable diseases and uncommunicable diseases, just for us to have a refresher in the context of COVID-19. Of course, COVID-19 is a communicable disease because it's a disease that is transmitted from one person to another through various routes. And we are aware the routes of COVID-19 prevention that we have always learned is through droplets, through contacts and other routes. And so basically it's a communicable disease, but also we have non-communicable diseases. These are diseases that cannot be transmitted from one person to another, but several factors could contribute to these conditions, and we call them lifestyle diseases. And this is where we have the blood pressure, we have the diabetic, we have the stroke, among other conditions. But what is important for us to note as we continue with this, as has been mentioned by the host, management of COVID-19 at home or whichever sports, is the evidence that has come out on the relationship between COVID-19 and the lifestyle conditions, whereby most of the individuals or people who have lifestyle conditions like diabetes and blood pressure are likely to experience severe cases of COVID-19. And that is very, very important for us in the context of Kenyatta University. As a university, we have a population with a mixed, which is very vast in terms of our demographic, in terms of age. We have a population that has the students who are aged between 18 to 18 to whichever highest, depending on the level of study. And we also have the staff that are aged between the lowest to around 25, and we go up to around 70 plus. And that gives, in the context of the university, gives us like a representation of the larger population. That implies that we have people who are likely to have the lifestyle diseases conditions, who are likely to develop the severe cases, and also we have a population that is young, that are likely to engage in other risky practices that are likely to spur up or skyrocket the COVID-19 spread. And so that is why it was important for us to also to have a brief on that. And then when we look at the just generally basic information on the incubation period, that is 2 to 14 days, and this could be already information that we have. And then we also are aware of the disease progression from the point of infection and to the outcome, and whereby the outcome of the condition depends also on a number of factors that I've mentioned, depends on the comorbidities, depends on the age, depends on the response, depends on the time of diagnosis and other factors. But what is also important for us, that is the current discussion at the national level, is where we are as a country as we talk. And we realize that since this data is up to 16th February. So this is data up to 16th February, that is on Wednesday. I know there's some updated data for yesterday. So this is up to 16th, that is Wednesday this week, where we are talking about 300 and in 2,000 cases, and these cases are amongst male and female, and you realize that we have higher infections, or we have had higher cases among the male, and we have also had around 5,633 deaths. What is important to note is our location at Kenyatta University, Nairobi and Kiambu, where we have had 46.7% of the cases. This is the national proportion. So it means almost half of the cases that have been documented come from Kiambu and come from Nairobi County. And this is where squarely our institution lies. And this is very important for us, not only for COVID-19, but it also informs us in the future. In case of any outbreak in the future, then we realize that we are in the hotspot areas. And then we talk about the case fatality rate, which is at 1.7. That is data by Wednesday this week, and then local transmission at 95%. So it means that we only have 5% imported cases. And up to yesterday, we are talking about a positivity rate of 0.4, and that's why I'm saying that we are at our lowest. When you talk about 0.4 positivity rates, it means that if we sample around 10 people for a COVID-19 test, then we'd have less than one turning to be positive. So the implication of that is that we are at our best at our country, but what really do we need to do as we move forward? Then it's also important to take note of this in terms of presentation of the disease, whereby most of the symptoms that we have are cough and fever at 52% and 33%. But I want us to look at the graph, which is very, very important for us, and important for us as we relate with this as an institution, that we have the asymptomatic cases and the asymptomatic cases. This is data that has been documented over time. When you talk about the symptomatic cases, these are cases that have COVID-19, and you are able to present the symptoms. They are able to show the symptoms so that they are likely to seek for treatment. But we have asymptomatic cases. These are cases that have the condition, but they don't show any signs, they don't show any symptoms, and therefore this is the most dangerous population. In the context of Kenyatta University, what does this tell us? That we could have 90% of our population having COVID-19, but they don't show any signs, they don't show any symptoms. And only 10% will have any signs and symptoms that indicate that they have COVID-19. And so that really tells us that as far as the prevention and control is concerned, we still need to continue adhering to the COVID-19 protocols, because there's likely that we have a population that is asymptomatic, and most of this population are young people, and they are likely to transmit it to the older generation, the people at risk, and the people at risk are likely to show the signs and the symptoms. Now, what is now important to us, and I think this is where I think more effort needs to be pushed as an institution, is the data that is the current national data on the COVID-19 vaccination. And I'm not sure whether as a university, maybe from the Directorate of Health Unit, whether we are able to capture the data of the Kenyatta University staff who have been partially vaccinated, fully vaccinated, and those who have gone for the booster as an institution, because that will be very important for us as we move forward. So partially vaccinated nationally, we are talking about 7,000 plus, and fully vaccinated, we are also talking about, 7 million. Fully vaccinated, we are also talking about 7 million plus, that is at adult. Then we have age 15 to 17 at 795,000, and then we have 15 to 17 again, and at 16,000. And then the booster dose, that is what is the current campaign, is that most of those who are fully vaccinated would go for a booster dose, is still very low at 235,123. And I think the current low prevalence and positivity rate that we are recording could directly be related, or there's a very close relationship now with the vaccine uptake. And it's also very, very important for us to really ensure that most of our staff really take up the vaccine, even the booster dose. This is also just for knowledge purposes, that the symptoms of COVID-19 would really range from mild to moderate to severe, And currently, I think we are having most cases are mild or moderate. We don't have severe cases because of the vaccination, because as per yesterday data, we only have 3 admissions, national, that is national, the whole country. We only have 3 admissions at the ICU. And I think that is something that is a good report, and that could be related to the vaccine uptake among the population. And even when you narrow down to the institution, that would really be important for us to push forward. And overall, we talk about a fertility rate of 2.7, but you also realize that as a country, currently, as per 16th, we were talking about 1.7. And basically, these are just some of the signs and the symptoms that we could have been aware of, but it's important that we also take note of them. The common symptoms, the fever, the cough, tiredness, and loss of taste or loss of smell. And because some other conditions also present with the same. But so it's just important for us to have a refresher, because sometimes when the way things are going down, people are likely to forget, people are likely to just move on, but you never know what will come in the near future. And the other symptoms which are not very common are the sore throat, the headache, ache and the pain, the diarrhea, rash and skin, and then the red or irritated eye. And this is very important for us at the household level, so that we are able to spot some of these symptoms. If the person who is present with these symptoms, you are likely to identify, and then you are likely to inquire and find out, or maybe just seek for tests to know whether to confirm whether it is the case. Why is it important to confirm? Because in the household context, in the household context and the dynamics of the families in Kenya, you realize that you have all the age cohorts within the households. And if a younger person presents with these symptoms and they have the COVID-19, at that point, this is a likelihood that there's a possibility of spread to the older persons within the households. Then we have the serious symptoms, difficulty in breathing or shortness of breath, then loss of speech or mobility or confusion. Then we have the chest pains. Of course, chest pain could also be as a result of other conditions. So it means that this cannot be confirmed when you do a laboratory tests. And what is the advice at the household level? Still, it is advised that we do not manage the signs and the symptoms without seeking for treatment, because you could be addressing a different condition thinking you're addressing COVID-19. That has been documented. And you could also be addressing it in a way that is not able to really manage the person or the patient at that point in time. So it's important that if you experience any of the signs or the symptoms, it's important for that we seek medical attention. And it's advised that if you have the contacts, like at Kenyatta University, you have the contact of the health unit, you are likely to do a call and just inquire so that you can be advised further. And then it's also recommended that those people who suffer mild symptoms, otherwise healthy, could be managed at home. But it's also important that as you do the management at home, you do it after consultation with a healthcare worker. That is very, very important for us. Hi, hello, I hope we are moving together.
Dr. Waka, we are with you.
Thank you so much. Thank you so much. And when to the transmission, the main route of transmission that I think has come out with a lot of documentation is the transmission by droplets. And I think this is why we always have we have been having this public health intervention of the social distancing, the mask, and minimizing crowds. And droplets are invisible. And they remain to be invisible. And even as we talk of low positivity rates, any one transmission would result into a severe outcome. And or to the worst, could result into a death, or could result into admission that could result into large amount of bills in terms of treatment. So it means that even reducing the infection even by one person is very, very important at the household level. And so it's important that we continue to adhere to the protocol, though from the discussion that I had yesterday is that with the current trend, the government is likely to review and see whether they are likely to open up or have new guidelines in terms of the prevention. I'd want to move to this that I think is very critical for us to understand. I'm trying to, there's something blocking my presentation here. I don't know how to remove it. On the right-hand side there. Okay, say I'm done. Sorry, I've done it. I've managed. Yeah. So I think the current campaign and the current focus for the government is the vaccine, and also to take up the booster vaccine. But I think it's also important for us to also come to appreciate some of the myths that we have had around, and also get some of the facts. And there are around many factors that really informed the vaccine as the key intervention as we talk now, is because of a number of research that has been done and the success of the vaccine that has also been documented in other countries, including Kenya. But I just want us to run through some of the myths and some of the facts. The first is that it was rushed and it isn't safe. I think the fact that has been documented that researchers took no safety shortcut, and large studies show the vaccine is safe. And the second one, that it changes your DNA. I think we have had this a lot, and we have also had a number of information in the internet, online. It is impossible for the vaccine to change the DNA. That is a fact. And then it can give you COVID-19, that those who get the vaccination are also likely to get the COVID-19 through the vaccine. And the fact is that the vaccine doesn't contain a live virus strain, and that it contains X protein. And that is a myth that I think even when we Google in the internet, would have a number of information talking about that. And the fact that it does not have egg protein and can be given to people with egg allergies. Then the second last one, that it causes severe side effects. And I think this one we could also share this from our experiences, that for most, the vaccine causes mild side effects that resolve in few days. And I think that it could be the experiences of most of us who have taken the vaccine. And the last one, that it makes women infertile. And I think this one there's a lot of discussion that went to this, more so in the rural communities, but there's no evidence that the vaccine causes infertility. So I think those are some of the myths and some of the facts. And I think from this discussion, we could also hear of some of the myths and some of the facts that we could add into this discussion. I think I'm almost, my presentation is almost done, but let's look at a few things here. Just to recap on some of the interventions that have been put in place, you realize that from this chart that we have here, the social distance, the masks, avoiding the crowd, and then hand washing, the first 4 interventions were in place, and you realize that despite that they were in place for quite some months, as a country, we did not realize a significant drop in transmission of cases. Yeah, we kept on having spiked prevalence until when the government and globally direction came onto the uptake of the vaccine. That is now number 5. And from this point, when we started the vaccine, I think we realized a reduction in cases. But this does not imply that we do not, we drop down all other cases. As we talk today, there's no communication, there's no direction to that. But what is important to note that we have achieved a greater milestone in reduction of cases from the time when the county started working on the vaccine. But in the context of the university, it is important that we continue to adhere to the protocol together. As we continue to upscale the vaccination, we also adhere to the protocol in terms of ensuring the personal hygiene, ensuring social distancing, ensuring we minimize the crowd in our classes and the rest, and also we ensure hand washing in place. I think this is just a recap, which is we have talked about. And basically, we have also talked about the issues of secondary prevention. And at individual level, we have talked of diagnosis, we have talked of seeking of healthcare, consultation of the doctor. And what is very important for me when it comes to individual effort is number 2, diagnosis and treatment with antibiotic or physician prescribed medicine, because a number of household or a number of individuals have turned to individual diagnosis and individual treatment, and that results into misuse of antibiotic, or even taking treatment that is not relevant. And so any treatment or any home-based care must be done in consultation with a healthcare worker, so that you are sure you are taking the right medication and you are doing the right thing at any given moment. So even as we talk about home-based care or individual management of cases at home, it is very, very important that that has to be done in consultation with the health workers, so that we do not get the wrong treatment, or if somebody has comorbidities or other conditions, then you ensure that the drugs that is being taken does not really interfere with the historical intervention or the historical medication of an individual. I think this is also very important for us when it comes to isolation and quarantine. Currently, in case we have a family member or individuals who are experiencing the signs and the symptoms, even at the university level, then it's important for that staff to isolate himself from the staff members, from the physical meetings, until is confirmed to be negative. Today, we still have some stigma to some extent, and therefore people are not likely to report or tell others that they are experiencing COVID-19 symptoms or they are positive of COVID-19. But it's important as an institution that when staff or students are diagnosed or are identified to be COVID-19, then it is important that they're put on isolation or they do self-isolation to minimize the spread. I think this could be important for us to also take note of in terms of management of severe cases. Of course, management of severe cases are done in the hospital, but at some point in time, people are discharged to recover at home. It is also very, very important for us to note that sometimes the effect of COVID-19 would take a longer period. Even after somebody turns to be negative, they are likely to have some conditions that would recover over a period of time. And it's very, very important for us to take note of this, so that whoever is recovering is given time, or those who are in recovery, we know how to handle them, we know how to support them, so that they come up to full recovery. I think that could be coming to the end of our presentation today, but it's so important for us to see this in terms of decision-making as an institution, decision-making at the household level, that the government is pushing that we have high proportion of population being vaccinated, so that we have low community spread. And this is whereby I think from the Director of Health Unit, it is important for us to, if possible, I don't know how possible this would be, to have some data that shows the proportion of our population as an institution. Maybe from the student, it could be very difficult, but from the academic, from the staff perspective, we could really know how many of us have been partially vaccinated, how many are fully vaccinated, and how many have taken the booster dose, high vaccination rates, so that we have low community spread, and then we have less need to. This would really even ease the burden in the university. We could even go face to face of all the classes once we confirm that a better population of the staff are fully vaccinated and have taken the booster dose. Then even the university could consider resumption of classes for all the students, if we are able to confirm that all of us have the booster dose. Otherwise, thank you so much for this opportunity for the presentation. I'll want to take it back to Dr. Wari. Thank you.
Yes, thank you, Dr. Isaac. I think that was quite an elaborate and comprehensive discussion on infection control. and what we can do. And I always like these presentations because they are very practical. And I like the challenge that we have as, and particularly to us as University Health Services. And maybe to just start off the discussion, Daktari and colleagues, I would just want to inform staff and also listeners that for the staff, we estimate that we are about 87% vaccinated in terms of complete vaccination. That is the primary series. For the booster, since we started this second month, we have so far about 577 staff vaccinated. And that represents about 19% of all KU staff. So there is still a challenge, and maybe using this, this platform and the challenge that we've received from Dr. Owaka is to encourage all of us that have not yet come for the booster, that as we've heard, it's safe, and it's actually key to resumption of normality. So we are at 19% with the booster, with only 570 Kenyatta University staff vaccinated, boosted. So we need more people to come, and the boosting, the vaccine is available at the health unit. We have set 2 days for the booster, that is Thursday and Friday. So all of you are welcome. And there are actually no queues. As I know, we still remember the queues that we used to have when the vaccination program started. Yeah, so thank you very much, Dr. Isaac. And maybe now this is a time that we have questions. And I think quite a number of issues came up. And as I was listening to your presentation, I thought of the issue of airborne. Of course, we always think of COVID-19 as droplets, but maybe I would want to hear your comments. Can COVID-19 be airborne? Dr. Isaac?
Thank you so much, Daktari. I think I'd also want to hear from the medics on the ground, but so far, I think the droplets is the main route of transmission that is so far documented. But you know, it is still room for research. There's still a lot that is still coming up that is being documented. But so far, airborne transmission without droplets, I've not heard of any. But we can also hear from others on the same.
Yes, thank you. I don't know if there would be any other person, maybe from the health sciences, could give us a comment on that. So I also had another query, and as at the health services or as practitioners, we have noted that there seems to be some correlations with other respiratory diseases, and particularly tuberculosis. Like, for example, I think the infection prevention strategies that have been put in place for COVID-19 seem to have a beneficial effect on tuberculosis or other respiratory illnesses. Yeah, so maybe I would want to get your comment, Dr. Waka.
Thank you so much. I think I would want to agree that the COVID-19 protocol or intervention has had a lot of beneficial effects in many aspects. When it comes to tuberculosis, even those who are asthmatic, you see, there has been some beneficial effect from those interventions, and I would want to agree with that because even the route of transmission for tuberculosis is more of droplets, and so people have also, the populations have also benefited as we control COVID-19. Other conditions have also gone down, and I think that is the case even in terms of hygiene and sanitation conditions like diarrhea and the other gastrointestinal infections. We have had a drop because people have been washing their hands to prevent COVID-19, but they also prevent other conditions. Yeah, and even the hand washing practice that people have been doing, people are likely to maintain such practices for a longer period of time or make it a lifestyle. And that would really assist in also prevention of other conditions that we've had challenges before. Yeah.
So at this juncture, I would probably want to open the floor. Anybody who is listening or who is attending this meeting, kindly you can unmute and ask your question live, and Dr. Waka will answer it. So we can have I think we can, we open the floor. Anybody with a question regarding today's discussion and infection control? And even as people are thinking, I was wondering, Dr. Waka, I think what we have with COVID-19 at the moment should kind of inform the future or the trends, what we need to do. So I don't know, in your opinion, what would you say is now the next step? How is this pandemic going to go in view that currently, and as you told us, the positivity rate is about 0.4%. What are these future projections? Where do we see, what are your like predictions, or from kind of an expert predictions? What is coming next? Are we going to have another upsurge, or is now COVID history?
Thank you so much. I'd want to comment on that with a disclaimer. Though historically, the history of pandemic that is related to virus pandemic, virus-related pandemic, historically, there's been documentation of 2 years. And so as we come to the 2 years and the trend that is going on, and the vaccine that has shown a lot of success, I know there's a lot of that is still going on in the field of research, and there's a lot of comparison of epidemiological data from globally, from country to country, and bringing to the context of Africa and to Kenya. And I think once that comparison is done, then I think the government, the MOH, is likely to give us a way forward. But from the look of things, it is unlikely that we are likely to have another upsurge. Thank you.
Thank you. I think that was a wonderful and excellent presentation, very clear and practical. And I really want to thank you for preparing it. I know a lot goes into the preparation for this meeting. And I really want to thank you, and of course, by extension, the School of Public Health, Kenyatta University, for actually being the presenters of today's presentation. We really appreciate you, and we have learned a lot. So I think in the absence of any other question, I would want to close this meeting this time. Any last question? You can unmute. And of course, these webinars are organized on behalf of the COVID-19 Implementation Committee, which is a committee in the university that coordinates the COVID interventions. So on behalf of the committee, I would want to thank you, Dr. Isaac Owaka, for making time for us today and for your presentation. Thank you, everybody, for making time to attend this meeting. We look forward to meeting you next week, same time. Tell your friends. And actually, we also encourage people in the satellite campuses. This session is also being live streamed on KUTV, on Facebook, and on YouTube. So you can log in on all those platforms. So thank you very much, and I wish you a good day, and God bless you. Thank you.
Thank you.
Thank you, too.